volume provides two sets of cost estimates. One for the cost of each intervention in this essential package, and another that is an estimate of the cost of the whole package. And this package of essential intervention consists of 36 elements. It's actually quite wide-ranging and quite detailed. So Shushi's mentioned a few of these. And they range from interventions at the fiscal and public health level, so the population level, to intervention at the primary care level, to interventions at the level of specialized care. So the estimates show that on average, it would cost a lower middle-income country about 1.5% of its GDP to implement the essential package and scale coverage rates up to the level that we know in upper middle-income countries. So expressed differently, this comprehensive program of 36 different policy interventions could be achieved by increasing government health expenditures by 92% in low middle income countries. This is reasonable, given the breadth of the package and the scale of benefit it affords. It's not unreasonable as a scale up. Now, the costs are much higher in relative terms in lower income countries. However, there's considerable variability in the cost of each of these single interventions in the package. So this means that many programs in the essential package are affordable, even in lower income settings. And a more feasible strategy for these contexts would be implementing a suite of interventions that we know to be more affordable or more cost effective, at least in an initial stage.
In addition to saying that governments could choose the more affordable interventions, we also say that they could choose interventions for diseases for which their burden is highest.
Okay, so let's try to put this in sort of monetary terms. So what we're talking about here is an essential package that would cost around, on average, $22 per person in a lower income setting. And that represents about 4% of current gross national income per capita of these countries. So something that's equivalent, again, is very conceptually speaking, to a country experiencing 4% growth in income would be enough to cover the cost of this package in a lower income setting, where actually these costs are a little bit more steep. In a lower middle income country, the costs per capita are $39 per person for the whole package, which represents a smaller fraction of GNI. We're talking about 2.1% of gross national income per capita in that setting. In terms of government spending would have to be scaled up, again, by about 190%, almost, for lower income settings, government spending on healthcare, in order to, again, afford all of these programs. And as I said before, about 134% increase for lower middle incomes.